The ethical principles, the four ethical principles that are dominant in medical and healthcare ethics are autonomy, beneficence, non-maleficence, and justice. And these can be used every day by people that are in healthcare and caring roles. And for example, it might be that you, as part of your reflective process that you'll be doing pretty much every day in your life as a professional, you may be thinking about some little problems that might look like little problems because they're everyday problems, like if you're on a busy ward, you've got patients that are calling for you all the time, and other patients that are silent and trying to work out whether or not it's the right or good thing to go to the ones that are calling compared to the ones that are silent, and trying to work out whether or not it's the best thing to do, whichever one of those it is, when you've got those sort of everyday decisions to make. And it might be that when you're thinking this through in your reflective process, that you might want to look at those issues through the lens of perhaps utilitarianism, deontology. So, for example, it could be the right thing to always, and there might even be a rule within the hospital that you work, it might be the right thing always to go to somebody who's pressing a call buzzer within a certain amount of time. On the other hand, you've got to bear in mind that there are other people that might need your attention, who are perhaps suffering from pain, or suffering in silence from a medical condition that needs to be dealt with straight away. That means that you go to them first, and then you don't follow the rule, and that to be looking at it through the lens of utilitarianism, because it's the consequence of your action that you're considering. So in everyday decision making, really, you can think really clearly about these sort of decisions that might just seem like sort of an unanswerable question, really. Which one of those do you go to? They both got needs, and just have to make a sort of snap decision in the moment. But you can put these sort of tools to making those decisions. The same thing goes with the four principles approach as well. When you, especially around things like consent, when you're trying to work out whether autonomy overrides the doing the good thing every time, and for your patient, and again, it can help you to think very clearly, and it can help you to explain it to other health professionals why you've made the decision that you've made, using that sort of general framework. As far as making autonomous decisions are concerned, even if we value autonomous decision making over everything else, conditions like dementia can have effects at different times within the patient's lifespan. And for example, in a condition outside of dementia, if somebody's had the spinal column severed in an accident, for example, often if you ask that person shortly after the accident whether they'd like to have their life support machine switched off, a lot of people will say yes, they would. But then if you ask them several months down the line, them having had treatment and come to terms with their condition, and seen that they've got some good quality of life and family and all of those things, then the majority of them will say that they wouldn't want that. So the time when you ask people the question might well determine what the answer is, and it might be that you as a professional might know something more about the condition than they do, and have experience of how this is panned out for other people, and maybe then the beneficence and non-maleficence side of the four principles will take precedence over the autonomy issue, because you'll know that even if you're putting autonomy above everything else, maybe in a few weeks or months' time, they'll come up with a different answer. And with dementia, of course, people get raised and lowered levels of consciousness and ability to make decisions as well on a measurable scale, and even throughout the day, sometimes a person who's suffering from some kinds of dementia and at certain stages within that conditions process will have better ability to make informed decisions than other parts of the day, and also the conditions will sometimes rise and fall over a period of weeks and months as well, and years. Generally, it's a deteriorating process, but sometimes people can rise up through their ability to make decisions as well, and so we've got to bear this in mind when and it's not as simple as saying that we should always take what the patient says, or that we've made an assessment of a patient on one day that they can't make decisions, and then see them again on another day, and maybe they can, and so again, each time that decision is made, it's got to be decided whether by the professional whether or not they're able to make those sort of decisions.